Hello friends, today our topic is neonatal hypothermia. Neonatal hypothermia. So first of all, what is the normal temperature? Normal temperature of a newborn. The normal temperature for a newborn is 36.5 to 37.5 degree Celsius. Okay, the normal temperature is 36.5 to 37.5 degrees Celsius. So what is the definition of neonatal hypothermia? The definition is axillary temperature less than 36.5 degrees Celsius in a neonate. So when the axillary temperature is less than 36.5 degrees Celsius, we call it neonatal hypothermia. Now we can classify neonatal hypothermia into three. Number one, cold stress. Cold stress. Number two, moderate hypothermia. And number three, severe hypothermia. So what is cold stress? If the temperature is between 36 to 36.4 degrees Celsius, that is cold stress. And what is moderate hypothermia? If the temperature is between 32 to 35.9 degrees Celsius, that is moderate hypothermia. And any temperature below 32 degrees Celsius is severe hypothermia. So cold stress is temperature between 36 to 36.4, moderate hypothermia 32 to 35.9 degrees Celsius, and severe hypothermia is less than 32 degrees Celsius. Now there are some mechanisms of heat loss. Mechanisms of heat loss. What are those? Number one, evaporation. Number two, conduction. Number three, radiation. And number four, convection. So the heat is lost by means of evaporation, conduction, radiation, or convection. Now newborns, especially the premature ones, why they are prone to hypothermia? Why they are prone to hypothermia? There are several reasons for that. Reason number one, they have a larger body surface area compared to body weight, especially the large head size. Larger body surface area, especially the larger head size. Okay, now reason number two. The reason number two is they have less amount of subcutaneous fat or less amount of brown fat. Okay. Number three. The reason number three is shear wearing is absent. Shear wearing is absent in newborns, so they cannot generate heat. And reason number four, which is seen in preterms, extensor posture, which also helps in heat loss. So why newborns are prone to hypothermia? Number one, larger body surface area, especially the larger head size, less subcutaneous fat or less brown fat, no shear wearing, and extensor posture, especially in the premature ones. Now there are some mechanism. There are some mechanism in the neonates to prevent hypothermia. Mechanism of prevention. Let's discuss those. Mechanism number one, which is non-shear wearing thermogenesis. As shear wearing is absent, so the mechanism includes non-shear wearing thermogenesis, which is possible due to presence of brown fat. Presence of brown fat. Now what is brown fat? Brown fat is lipid deposits rich in mitochondria. Okay, lipid deposits rich in mitochondria. Those are called brown fats. Now there are some special regions where brown fat is found more compared to other areas. What are those areas? Number one, nape of neck. Number two, axilla. Then groin. Then intrascapular region. then sternal area, and lastly the periadrenal and perirenal areas. So these are some areas where brown fat is found in more amount compared to other areas: nape of neck, axilla, groin, interscapulary area, sternal area, periadrenal and perirenal areas. Okay, now let's proceed how this non-triggering thermogenesis works. When hypothermia occurs in a newborn, the baby is in stress, and being in stress, body releases catecholamine, especially noradrenaline. Okay, this noradrenaline helps in uncoupling of oxidation of fat, and heat is generated. Okay, so let's see again. Hypothermia leads to stress, leads to release of noradrenaline. This noradrenaline helps in uncoupling of oxidation of fat, and thus heat is generated. So this was the first mechanism, non-shivering thermogenesis. Now number 2, which is cutaneous vasoconstriction when exposed to cold in order to prevent hypothermia. So cutaneous vasoconstriction. Number 3, flex posture of the baby, and number 4, higher heart rate. More the heart rate, more the heat generation. So these are some mechanisms by which a neonate prevents the hypothermia. Number 1, non-shivering thermogenesis. Number 2, cutaneous vasoconstriction. Number 3, flex posture, and number 4, higher heart rate. Now proceed to management of hypothermia, or rather prevention of hypothermia. Management or prevention of hypothermia. Okay, first of all, we have something called warm chain. This warm chain has to be followed to prevent hypothermia. It consists of 10 components. What are those 10 components of warm chain? Number 1, temperature of delivery room should be 25 degrees Celsius. Okay. Number 2, warm resuscitation. Number 3, immediate drying of the baby. Number 4, skin to skin contact between the mother and the baby. Number 5, early initiation of breastfeeding. Number 6, bathing should be postponed. Okay. Number 7, adequate clothing for the newborn. Number 8, rooming in. Number 9, warm transport. And finally, number 10, training and awareness. Okay, so these are the 10 components of warm chain. Temperature of delivery room should be 25 degrees Celsius, warm resuscitation, immediate drying of the baby, skin to skin contact between mother and the baby, early initiation of breastfeeding, birthing should be postponed, adequate clothing for the baby, rooming in, warm transport, and training and awareness. This should be followed in order to prevent hypothermia. Now there are two scenarios in front of us when we approach to manage a case of hypothermia. Hypothermia. The baby may be stable or unstable. Stable, unstable. Okay, may be stable, may be unstable. If the baby is unstable, then we have to start with radiant warmer or incubator. Okay, the radiant warmer provides warmth by means of radiation, and mechanism of incubator is convection. So if the baby with hypothermia is unstable, then we have to start with radiant warmer or incubator. But what if the baby is hypothermic but stable? Then we have to start with KMC. What is KMC? Kangaroo mother care. So if the baby is stable and hypothermic, we have to start with kangaroo mother care. What is kangaroo mother care? The kangaroo mother care is basically skin to skin contact between the mother and the baby or any other caregiver. Okay, so let's discuss the components of KMC. Components of KMC. As we already know, one component is skin to skin contact. Another component is exclusive breastfeeding, and the third is early discharge from hospital. These are the three components of KMC. Now, up till when KMC should be continued? KMC should be continued till the baby attains 37 weeks of gestation. What does it mean? 37 weeks of gestation. Suppose a baby is born at 34 weeks of gestation. So after his birth, after 3 weeks, his or her gestational age will be 37 weeks. So we will continue kangaroo mother care up till 37 weeks of gestation, or up to achievement of body weight more than 2.5 kilogram. If the baby attains a body weight of more than 2.5 kg, then we can discontinue kangaroo mother care. Now, what are the advantages of kangaroo mother care? Advantages of KMC. Advantage number 1: lesser risk of hypothermia. Okay. Number 2: lesser risk of infection. Number 3: as lesser risk of hypothermia, lesser risk of infection is there, so obviously lesser mortality. Number 4: increased exclusive breastfeeding rates, as EBF is the component of kangaroo mother care. And finally, early discharge from hospitals or less duration of hospital stay. And finally, mother and child bonding. Okay, so these are the advantages of kangaroo mother care: lesser risk of hypothermia, lesser risk of infection, lesser mortality, increased exclusive breastfeeding, early discharge, that means less hospital stay, and finally bonding between mother and child. So let's end the session with a quick recapitulation. Neonatal hypothermia. Okay, so the normal temperature of a newborn was 36.5 to 37.5 degrees Celsius. Now, what is neonatal hypothermia? When the auxiliary temperature is less than 36.5 degrees Celsius, we call it neonatal hypothermia. There are 3 types of neonatal hypothermia. Number 1, cold stress, then moderate hypothermia, then severe hypothermia. Cold stress is when the temperature is 36 to 36.4 degrees Celsius, moderate hypothermia 32 to 35.9 degrees Celsius, and severe hypothermia less than 32 degrees Celsius. Now, the mechanisms of heat loss. There are 4 mechanisms: evaporation, conduction, radiation, and convection, by which heat is lost. Now, the next point is why newborns, especially the low birth weight or prematures, are prone to hypothermia. The answer is larger body surface area compared to body weight, especially the larger head size. Number 2 is less subcutaneous fat or brown fat, no shivering, and extensor posture, especially in preterms. Okay, now there are some mechanisms in the newborns to prevent hypothermia. The first of all, non-shivering thermogenesis, which is possible due to presence of brown fat. And what is brown fat? It is lipid deposits rich in mitochondria. So this brown fat is found in some regions more than the others. So the brown fat rich areas are nape of neck, axilla, groin, intrascapular area, sternal area, periadenal and perirenal areas. How this non-shivering thermogenesis works? When there is hypothermia, the baby is in stress. The catecholamine, especially the noradrenaline, is released. It uncouples the oxidation of fat and heat is generated. Okay. Now, cutaneous vasoconstriction when exposed to cold. This prevents loss of heat. and the flexed posture and high heart rate also contributes in maintaining normal body temperature. Now the management or prevention of hypothermia. First of all, warm chain. We have to follow the warm chain to prevent neonatal hypothermia. There are 10 components. What are those? Temperature of delivery room should be 25 degrees Celsius, warm resuscitation, immediate drying, skin to skin contact, early initiation of breastfeeding, birthing should be postponed. Adequate clothing, rooming in, warm transport, and training and awareness. These are the components of warm chain. Now, how to approach and managing a case of hypothermia. If the baby is unstable, then we have to start with radiant warmer or incubator. The radiant warmer acts by mechanism of radiation and incubator acts by convection. And if the baby is stable, we have to start with KMC or kangaroo mother care. It is basically skin to skin care, skin to skin contact between the mother and the baby. So what are the components of kangaroo mother care? As we know already, number 1, skin to skin contact, then exclusive breastfeeding, then early discharge from hospital. And when to stop kangaroo mother care? When the baby attains 37 weeks of gestation or 2.5 kg of body weight. Now some advantage of kangaroo mother care. Lesser risk of hypothermia, lesser risk of infection, so lesser mortality, increased rate of exclusive breastfeeding, early discharge from hospital, and good mother and child bonding. So this was all about neonatal hypothermia. Thank you.